Member for North Vancouver Seymour.
Thank you, Mr. Speaker, for the opportunity to rise and respond to the motion expressed by my colleague and neighbour from West Van Capilano. To begin, I acknowledge that I'm speaking on the lands of the Lekwungen, speaking specifically those of the Songhees and Esquimalt people. Additionally, I also acknowledge the unceded territory of the Squamish and Tsleil-Waututh nations, where my home and riding is situated. It is indeed a privilege to work, learn and live on these territories that have been and continue to be stewarded for so long and so well. Mr. Speaker, it must be difficult to be on the opposition in any political realm, as it seems that the opposition, as opposition, all debates are in the negative. You don't get the chance to extol the positive
Of course, this
things.
is a private member's time, so not opposition versus government.
Oh, my apologies,
yeah,
Mr. Speaker. I do take that back. I apologize. So I get the chance to extol the positive things that go on in our communities, our ridings, in our provinces. So let's start with the $1 billion that was distributed last week amongst all of the communities and regional districts throughout the province, that translated to just about $30 million across the North Shore municipalities for municipal projects that might not have otherwise been afforded. Let's talk about the strategies that have been actioned over the past couple of years to remediate the gutting of the healthcare system that took place in the early 2000s. I was there then, and I and my teams continued to try to provide effective and community-based client care over the next 16 years in spite of the cuts, and in spite of the empty promises that community health would get increased funding to keep clients closer to home. Now we can look to actions that have been implemented to support our healthcare providers, which in turn support our patients. 600+ new training positions for nurses in BC, funding for internationally trained nurses towards getting their education and skills recognized in a timely fashion so that they can join our nursing workforce much sooner than in the past. I was recently in the Skills Lab in Kwantlen College, where internationally trained applicants are able to demonstrate their expertise so they can be signed off as ready or work on areas that need improvement. Recent changes in payment and fee structures were accepted by both family physicians and resident physicians. Additionally, some specialists, such as those working towards cancer diagnosis and treatment, were also getting their funding increased. A new medical school is opening at Simon Fraser University so that more medical students can be trained in our province. The number of residencies has also increased, and we have the opportunities for associate physicians who are internationally trained to work with the oversight of local doctors while getting accredited towards working independently. Around 2017, we were able to see a difference in the community setting. My case management team was comprised of nurses and social workers who carried a caseload of approximately 100 to 120 clients each. These were clients that had conditions that could result in long-term care placement. However, we were supporting them to stay at home. We also supported the caregivers. We initiated and managed home support, arranged for respite in or out of the home, attached clients to public or nonprofit resources, and helped transition them home from hospitalizations, as well as moving them on to a higher level of care if they could no longer be managed in the home. Imagine how much more we were able to do for our clients when we were able to add 3 licensed practical nurses, 2 community liaison workers to our team. Not only were we able to have more clients on our caseloads, but we were able to provide a broader range of services, such as wound and catheter care, or helping eligible clients to apply for benefits that they'd not known about or accessed. Finally, in 2018, we were getting the help in community that had been promised for years. Mr. Speaker, there is no denying that there is more work to be done in rebuilding, maintaining, and supporting our healthcare system. And I am continually grateful for the ongoing, valuable, and exceptional work that all of our healthcare clinicians have been providing and continue to provide to the people of British Columbia. Thank you to nurses, doctors, community health workers, and care aides, physical and occupational therapists, social workers, dietitians, first responders, and all of the healthcare providers that are part of our complex, caring, and strengthening healthcare system. I am so proud to be part of a government that continues to value all of their work. Thank you, Mr. Speaker.
Thank you, Member.